The philosophy of HealthBridge is that we strive to be the provider of choice for post-acute care. We look to be the innovative provider of post-acute care, but additionally we know that we take care of people and residents, so we always want to have that focus on dignity and their quality of life. A lot of our residents and patients really enjoy being here at our HealthBridge facilities due to the fact that our staff are so caring, they're so clinically focused, and they're really caring for the residents' needs, not only their physical needs, but their emotional and mental needs as well.
They're the greatest. Everybody. The nurses all are very capable, and they do a good job. Take care of you. If you have a question, they'll answer it. That's the best part of it. You're not left alone.
HealthBridge facilities take care of orthopedic patients, very medical complex patients, patients with pulmonary issues such as COPD and heart failure. We do have some facilities that take trach patients as well, and probably half of our facilities also take care of Alzheimer's residents. The HealthBridge chain provides physical, occupational and speech therapy services, and in some of our focused centers we also do respiratory therapy services. Our staff have weekly rounds with the wound care staff at Vohra. Our residents have taken to the wound care here incredibly, overwhelmingly very positive. We've seen a big difference in the wounds that have been healing, which again then relates to a better quality of life for our residents.
When a patient is admitted with a wound, they don't need to go out to see a wound physician. He comes right here, he goes right into their room. They're seen right here in the facility for all their wound care needs.
There is a whole spectrum of wounds, of chronic wounds that we are consulted on, starting with pressure ulcers, including arterial ulcers, diabetic foot ulcers, and trauma wounds. I like to see the wound healed, obviously, and I like to see the significant progress that we're making on the very chronic wounds.
By having a physician, a wound specialist on board, able to conduct and do this wound debridement, and also with the nurses as a team working together, you can see the improvement. Because actually that approach is remarkable.
It tends to be pretty traumatizing if a resident has to leave our facility. So the ability for us to be able to treat patients' wounds with Vohra at the bedside is incredibly critical and has been very successful.
They're wonderful here. I can't complain about anyone. They've been good to me.
I'm very pleased with it, especially the nursing staff. They keep after it, as well as everybody who comes in.
I realize that it is my home, and they are guests in my home, and they're here to help me, and they do.
Residents and families are very savvy these days and have a lot of choices. I strongly do feel, though, at HealthBridge centers, we're on the cutting edge with innovative ways to take care of our residents, and the focus and the culture that everybody who comes into HealthBridge Center is really a part of our family.